Question. All right, y'all. There we go. Happy Monday. Welcome back. Apologies for my tardiness. Day job ran over, honey. That's all right though. I'm gonna give you a few minutes. We're doing the bonus session today for our Ready Set Sterilize series, helping you prepare for your CRCST and CBSPD exams. We did 4 free sessions back to back, covering all the basic areas and key concepts that are going to be on your exam. And in our last session last Monday, somebody asked if we could do a bonus session over surgical instruments. So I said yes, Chalice. Should have said no because it didn't really work out that well today. But I am here. So I want to go through the notes that I have prepared for y'all. As always, it will be available on the website once we go off this live. You will be able to access the this recording as well as any of the notes from this evening's class that will be available on the Candray Institute website. You can check that out as your at your leisure. Also, just fair warning for y'all, just a little housekeeping. I broke my glasses severely, so if it looks like I'm squinting at you, it's because I am. It's because I am. Hi, Lucinda. How are you? Welcome in. Welcome in. I'm gonna get my notes up on the screen, and then we're gonna get started. I thought that the best way for me to do this was just to kind of go through each of the, well, not each of the surgical instruments, but each of the surgical service lines. So when I say service line and surgical services, I'm talking about things like orthopedics, GYN, pediatrics, cardiovascular. Um, those are going to be within the surgery department. Those are going to be what we refer to as service lines. Now, when it comes to the service lines, all of them use the same basic instruments, same basic clamps, scissors, retractors. For the most part, they might be different sizes, they might be different lengths, but they will predominantly be the same type of instruments. Then we start getting to what we call specialized instruments that may be specific to that service line. So it might be some type of widget in ortho that I never use in OBGYN or I never use in cardiovascular surgery, right? And just all I always know when I see it, that's an orthopedic instrument. So we're gonna talk about both today. We're gonna talk about just some real basic instrumentation and then some of the things that are specialized. The big takeaway though from for today, especially for those of you that are getting ready for your exam, is care and handling. Okay, say it with me on the other side of that screen. Care and handling. Because it's not enough in sterile processing or surgical services for you to know your instruments and visually be able to identify them, but you also need to understand how do you take care of them because that is the primary function of your job is to keep them clean, sterile, and in safe working order. So we're going to talk about that, and you will find that that will come up on your exam. They will be asking you to identify instrumentation, but they will also be asking you how do you take care of it? How do you test it for efficacy? How do you actually know that it works? If I put it down in front of you, right? If I give you this pen and I told you just look at it, how do you figure out that this pen is clean and it actually works, right? So that's what we will be talking about today. As always, if you guys have any questions for me that are related to sterile processing, CRCST, CBSPD, or whatever the case may be in that realm, you are more than welcome to ask it at any time. These are your study sessions. Okay, let me get to the PDF and then we will get started. This is the last session for the CRCST Study Hall Series. If you missed them, they are on the YouTube page. So you just head over there, go to the live section. And because y'all are so awesome and asked about it, you will see not 4 free sessions now, but 5. Today is your 5th bonus session. If you're finding that you are in need of any type of individual coaching, just let us know. I can get that scheduled for you too. All right, here we go. Let me move that to this one. I'm a little out of my element. I don't usually be in this room when I teach, so if it looks like I'm like, where's the thing? And I'm out my element today, Haney. All right, there we go. So Up on the screen are today's notes. These will be available on the website as soon as we hop off here. I appreciate y'all over on TikTok land tapping the live. Most appreciated. Okay, so we are doing Ready Set Sterilize bonus session over surgical instruments, service line, and care. For those of you that have been through the Hillman Talk class, we are referencing the HSPA technical manual to prepare you for the CRCST. This is the most recent edition is the ninth edition. Now that being said, I'm gonna say this. If you have an older edition of the book, you can absolutely still study that and pass this exam, okay? Especially with all the supplemental information that you have via these videos and your CRCST Study Hall Series, right? You should be fine. But that being said, I do want to be very transparent and say that HSPA is currently on their ninth edition. If you guys are finding that you have questions out of the ninth edition, please don't hesitate to ask. You can type those in the chat or you can send those to me in an email. That's candray.institute@gmail.com. candray.institute@gmail.com. Okay. Our exam prep focus for today is instrument identification, classification, usage, and maintenance. Okay. Those are going to be the big takeaways that I want y'all to be able to come out of this study hall session with is have a clear understanding of not only how to identify the instrument, how does it get classified, which is basically going to be how do you use it or who's using it, usage, how do you use it, and maintenance, how do you take care of it, both as far as post-op, when they're done with it, how do I keep it in good working order, in decontam, how do I clean it, and then in prepping back, how do I make sure that it stays in good working order. Okay. In this session, we are going to take a look at common surgical instruments and their categories. We're going to look at your instruments by specialty, which we talked about that OBGYN, general and neuro, pediatrics, so on and so forth. There's a crap ton of them. Most hospitals have the same few basic ones, and then it gets more specialized as you go. And then we're going to review the care and handling to prevent damage and ensure patient safety. Okay, because again, that's the key focus of y'all's job. We'll be discussing visual inspection, which is going to take place in that assembly area, and testing techniques, right? So remember when I busted out my pen and I was like, well, how would you test this? And no, if I can't use it on the body in surgery and act like, like it's going to be used when it actually goes to the surgeon, how do I know that this thing works well? And part of that is because we have some testing techniques that you're going to learn about how we do those things in assembly to make sure that the instruments are actually working before we sterilize it so that when the surgeon receives it, they're good to go. Welcome in on TikTok. I appreciate y'all. Tap the screen if you don't mind. If you have any questions, don't hesitate to ask. And I appreciate the follow. All right. And then I have a few little practice exam quiz questions for you guys that'll be on there just to help you study. And for my TikTok folks, if y'all want to see the notes that I have on my screen, you want to head over to the YouTube. Otherwise, I will be here. And you know what? I wonder if I could. Can I get that? Y'all won't be able to see it if I turn it to that. Y'all won't be able to see it. This is the problem. Hey, Harry. Hi. It's good to see you too. He said it's nice to see you active again. I stayed active. I just went quiet for a little while. And things got a little bit crazy on the home front. But it's good to see you too. Thank you for tapping in. Okay, so section one, instrument categories and identification. We want to talk about the different types of instruments, okay? Before we even start getting into can you recognize X, Y, and Z, let's talk about the different types. So the first one I have up there, or this would be another way to say category, right? These are just basic instruments I was talking about. The first one we're going to look at is cutting and dissecting instruments. So, oh, I see TikTok. Head on over there, girl. Get on over there and you can see the notes. And also, guys, I know I'll probably repeat it 1,000 times for people coming through, but these notes will be up on the website as soon as class is over. Also, this live will remain on our YouTube. So all you have to do, if you miss it or you want to rerun something, head over to the Candray Institute on YouTube, check the live section, and you will see all 5 sessions of the Ready Set Sterilize CRCST Study Hall. You will also find a completely free CRCST prep course that we did with the Hillman Talk students from February in honor of Black History Month. We went from February till May. All of that information is still up there. I'm not taking it down until our next paid cohort gets settled. So take advantage, okay? That means you could potentially buy your ninth edition book, self study with that free test, and get certified. Okay, so with cutting and dissecting instruments, these are just what they sound like. These are going to be the tools you use to cut at or cut away tissue. These are going to be your scissors and your scalpels. And specifically in sterile processing, these are going to be your scalpel handles. Because you could think of your scalpel as almost like how this pen comes with the top. Your scalpel itself that you're going to use to cut also needs a handle with which you could use it, right? So in sterile processing, we will reprocess those handles more often than you will ever see a blade. Okay. And we make sure that those handles are in there so that when it gets to the operating room, the surgical tech, circulating nurse, or surgeon can marry it with the blade and then they're able to do their cutting. Okay. So the usage here is cutting tissue. We also use scissors when we suture or when we're dissecting. When I say dissecting, just cutting away. I might be cutting into to take a look. I might be cutting away a piece, right? For my ladies, we talked about those colposcopies, pulposcopies. When we go in, they will be using the surgical instrument to cut away tissue and then take that for testing. Okay. So that's what your first category is. Then our next category is grasping or holding instruments. Again, self explanatory like the scissors. Scissors are for cutting, grasping instruments are for grasping and holding. You're going to use things like Alice clamps, Babcocks and Cokers, or tissue forceps. These are going to be things that the surgeon or circulating nurse are going to use to hold on to tissue or other body parts and then use their other instruments to either manipulate or cut away at that tissue. Okay. So key thing about grasping and holding instruments is that they must do that. I know it sounds a little crazy, but they have to do that. If you find that your tissue forceps or your Babcock, your Coker doesn't clamp or hold, then it's useless in its function, right? So that would be something I could say, let me set this to the side, either get a replacement or make sure this gets out for repair because this grasping tool that I have isn't actually grasping or holding. Same thing for the scissors. We're going to have methods to test those for efficacy and make sure that they are sharp and they cut. Because I don't know about you, but I wouldn't want no dull piece of scissors used on me during surgery. So we would want to test those and make sure that they work properly. The last person that should find out something doesn't work right is your surgeon. That means you done dropped every ball imaginable. Okay. If it's at the surgical table and they're telling you that this isn't sharp enough or this isn't holding, this isn't clamping, we have a major ball that we're dropping down in the assembly section of sterile processing. Okay. It happens. It's not to say, bad tech or anything like that, but it means that we want to take a look at our process because that's exactly what assembly is there to prevent. So when it comes to grasping and holding, like I said, we use this to secure tissue or to secure organs without damaging them. We want to hold them and move them apart, but we're not trying to cut into them like we were using our dissecting instruments, right? We're not trying to hurt them. So these are going to be instruments that you want to have and make sure like their tips aren't too sharp. They might be a little rigid sometimes, but they shouldn't be like cutting instruments. All right. So when we have clamps that we want to not just retract or hold away, but we want to do what we call occlude. Now, occlude is a big word that means close off completely. So if I were to want to use a clamp instrument to occlude something, I might use a hemostat to stop the blood flow in a vessel, right? I would clamp that vessel and then I would keep that instrument closed so that that blood cannot no longer flow back and forth. That's what we mean when we say occlude, to completely close off. So that's a grasping instrument that you're going to put on and leave on, right? Until they're ready to let that blood flow again. So we can use them to stop blood flow. We can also use them to grasp vessels. And listen, we're surgical instrument reprocessing technicians. We are not surgeons. There might be other things, other bodily types of like tissues or veins that they might want to occlude. I don't know them all. But what I do know is that if they're looking for a clamp to do occlusion, it's going to be a clamp that does two things. One, it approximates. Now, what do I mean when I say approximate? If I have a pair of scissors and they're supposed to be evened up like this, for my folks on YouTube, my folks on TikTok, if my teeth of my scissors look like this, they're not approximated. Approximate. means for them to go together and be seamless, right? So when I have a scissor or a clamp or something that has two ends, I always am checking them in assembly to make sure that they don't look like this. They have approximated. Okay, that means that those instruments are going to actually work properly when it comes to occlusion. Because imagine if I had a clamp and the teeth are going like this and I'm trying to clamp a vessel. That's not going to really work that well. But if I'm able to clamp that vessel because the tips of my forceps or the tips of my clamps approximate, I may have a better use there. I might have a better time trying to get that to go. Okay, so that's something that in assembly we would be checking to see, does that actually go together? If I open and close that instrument, does it actually go together? If it didn't, that would be something we want to take out of our set to the side, get a replacement, and put that out for repair. Okay, so we looked at cutting instruments, we looked at retracting instruments, we looked at clamping and occluding instruments. Next up, we're talking about retractors that are meant to expose. Okay, so when we look at exposing tissue, sometimes when we're doing surgery, we do what we call open, which means we'll open up a larger space of the body, and then that has to be what we call retracted, right? So if we use this example of opening my chest, we would be cracking the chest, and then we would be using retractors to keep that sterile field open for your surgeon to be able to do their procedures in. That might be handheld retractors where your circulating nurse or your scrub tech are actually holding those instruments to keep that tissue from moving. Or it might be what we call self-retracting instruments, where they're designed to where we can kind of screw them on and they'll do their own thing and stay in place. Okay. So some examples of those are what we call Army Navies, Wheatlanders, Richardsons, and Gelpies. And those will be in your textbook. The use of these is to hold back tissue for visibility. Again, we're opening that space up so the surgeon can see. If we're trying to do surgery in a smaller space, we might use what we call laparoscopic instruments, and those are meant to be something that we can make smaller incisions in the tissue and then insert those instruments in cameras and scopes so that we can have that view. There will be retractors at that level as well, they just might not be as large. All right, next up we have suctioning instruments. So we've talked about how we can cut the tissue, how we can hold the tissue back, how we can occlude the tissue. But y'all know, just like when you go to the dentist and they flush in your mouth and they have everything in there. You made it, friend. Welcome in, welcome in. Welcome in over there on TikTok. I appreciate y'all coming in and tapping the screen. I appreciate y'all over on YouTube, liking and sharing. Somebody calling, baby. They must not knew we was in class. They not getting picked up. Okay. So just like when we go to the dentist, you might have all that fluid in your mouth, and they use those suctions to get all that good gunk out. Those are that instrument that they're using is what we call a suction instrument. Some examples of suctions are going to be things what we call Yankars or Fraser suction tips, and these are used to remove fluid from the surgical field. I'm gonna turn this off, y'all. We want to use those to remove fluid from the surgical field. And the reason being is again visibility. If your surgical field, like let's go with that chest again. If the surgical field is my chest being cracked open and it's full of blood, my surgeon can't see. So they can't actually do what they need to do. So we would use a suction to remove some of that fluid so that they're able to have good visibility. Okay, so that's five. Now, six. This is our last category here. Dilating and probing instruments. Dilating and probing. So when we're talking about dilating and probing instruments, we're talking about instruments that we use to make some type of cavity in the body wider than it currently is. Places you will see this often is what we call uterine dilators. So think about this: if I'm doing GY, or excuse me, if I'm doing urology surgery, and we could think about the ureter or the uretus, all of those tubes are very small, very thin, very tiny, right? I may use those dilators one size at a time to introduce to make that cavity bigger so that I can do surgery on it. We also sometimes see this in vaginal surgery with what we call vaginal dilators. Hi, Latoya. Welcome. Look, you the one got me working late on Monday. It's Latoya fault, y'all. Latoya is the reason why y'all got a fifth bonus session for free. Thank you, Latoya. Look, everybody say thank you, Latoya. Okay, so study tip for your flashcards. I would highly suggest that you spend time looking up some of these basic surgical instruments from your book and getting pictures of them for your flashcards. It can be a little expensive to print them out if you don't have a printer at home. You can always utilize your library. That's one of the best places to print for free, or print, excuse me, not print for free, print for cheap. Like in my library, you can print for 20 cents a page. And these don't need to be big images. You can put 3, 4, 5 instruments on a page and print them out and just have them for your flashcards. Okay. This again, just as a tip. You don't have to do that. You can absolutely study these from your book. I just like for you guys to have them with you so that you can quiz yourself. And some of the information you could put on there is the image of the instrument, but you can also just, if you don't have that or you don't want to put that effort into it, put the name, the use, how you test it, how you care for it. Okay. So you have some of that basic information in the notes above, but also in your book, there's going to be more specific information for each individual surgical instrument that they discuss. Okay. Any questions about section one before I get to moving on? I'll even scroll back up for y'all. So we looked at instrument types. We looked at number one, cutting and dissecting instruments. Those were your scissors, your scalpels. Those are things you use to cut tissue. Number two, we looked at holding or grasping instruments. These are going to be clamps that we use to hold tissue and secure it. These are not meant to do damage, so we want to make sure that they are in working order, okay? Right? If they don't approximate, can't use it. If they don't clamp, can't use it. Oh, wait a minute, wait a minute. Who's saying now, friend? There's an instrumentation flashcard book on Barnes and Nobles. I got mine years ago. Okay, good. That's Thank you for sharing that. Thank you for sharing that, Latoya. All right. Whoo. So that is a good thing. There are some products that you could buy if you don't want to make your own. Now, y'all know if y'all been in class with me for a while, y'all know I always recommend you make your own just because it's another layer of helping you to study. But as Latoya said, there are surgical instrument identification card sets that are available out and about in the world. Okay. We looked at clamping and occluding instruments. We looked at retracting tractor instruments, and we talked about suctioning instruments. The last one we looked at was dilation and probes. These were the ones we used to make make cavities a little bit wider. All right. Do I see? Okay. I would love that. I would love that. All right. Section two. So for section two, we're taking a look at those service lines and their common instruments and just any special notes I have about them. And again, reminding y'all that service lines, when we talk about that in surgical services, that's going to be the type of surgical procedures that they're doing. So whether that's general surgery, orthopedic, nerve or neurosurgery, spine surgery, OBGYN, pediatric, cardiovascular, there's many different types of surgery based on the different body systems that are being worked on, right? And we have basic surgical instruments that we use for almost all procedures, and then we have specialty instruments that you will usually only find in those different type of service lines. Okay. So looking at general surgery is going to use almost all basic type of scissors, clamps, probes, retractors that you could think of. They usually will have what we call a basic set. So this will be a set that might get used in multiple different types of procedures. And that we also turn what we have what we call high turnover. So for those of y'all that weren't in the class, turnover is when I'm using an instrument set in a surgical procedure and I need to make sure to prioritize getting it cleaned and assembled and sterilized again for an upcoming procedure that's happening pretty quickly, right? So it may be that I'm doing 5 procedures that are using my major basic trades, but I only have 4 of them, right? So when it comes to case number 5, I need to turn over case number 1 to get it ready for case number 5. And that's what we mean turnover. When I say high turnover, that means I'm doing that multiple times a day. So maybe I only have 3 general search, but I got 5 cases. So I'm turning these 2 over to get ready for later cases during the day. That makes sense. Okay. So for general surgery, you're going to be using what we call Mayo scissors, needle holders, hemostats, Army Navy retractors, basic Kelly and crowd clamps. You're going to see those in your basic sets. When we're looking at orthopedics, because we're dealing with bone, you're going to have some of those basic instruments, but you're also going to have what we call bone rongeurs. These are rongeurs that are designed to cut bone. Osteotome, these are metal chisels that are designed to chip away at bone. You will see mallets and you will also see screwdrivers. With orthopedics, you're usually looking at heavier instruments, okay? Big old mallets, things they're kind of knocking bones into place, putting screwing on plates and screws, right? So you might see screwdrivers and things of that nature in orthopedics. All right, let me make sure I don't see no questions coming from the YouTube. I don't. Let me scroll up and see, did I miss anything? All right. So the next service line I have on here is OBGYN. So OBGYN is your gynecological services. In GYN, you're going to use all the same basic surgical instruments, but you do have quite a bit of specialty stuff. Okay, we have tenaculums, we have uterine sounds. Sounds are going to be the same as your dilators. These are used for these particular ones, these are used to dilate the uterus, right? So, again, something that's going to be a small tube, those uterine tubes, and we would want to stretch it out by introducing these uterine sounds one by one. Lastly, for my ladies in the chat, I know you guys are familiar with speculums. So vaginal speculums, these are going to be used in OBGYN services to retract and open and keep the vaginal canal open. Something to know about these instruments, they can sometimes be delicate. They might be peel packed or packaged a little bit differently than your full sets. Okay, another service line. This one is called ear, nose, and throat. The abbreviation is ENT. So with ear, nose, and throat, you will be using a lot of the basic instruments, but they will be much smaller than the types you will use for OBGYN or general, right? Thinking about ears, nose, and throats being smaller cavities. So it might be a suction, but it will be a couple millimeters smaller than what you would use for GYN, okay? So ENT, think about like when you go to the dentist again, they're gonna have suctions to get all the fluid, spit, snot, mucus out of their visual, out of their visual field. They also have forceps that are bayonets, what we call bayonets. If you guys look a picture of that up, let me pull up one while I'm with y'all. It's just a funny looking kind of forceps that is used at an angle to help them get access to your ear, nose, and throat. I'm gonna pull one up on the screen real quick. Okay, so these are what bayonets look like. Let me stop sharing that one and start sharing this one. Okay, so if you can see here, this little forcep with its. Oh, we don't want we don't want your cookies, but we don't got time, so we'll take them. All right. So this is what a bayonet is referring to. See how there's this angle here? So this forceps starts, and I'll turn y'all so y'all can see. How about that? This forceps starts just going straight, and then it has this angle, and then goes straight again. That's a what we call bayonet forceps. And so they utilize those to be able to get angled into the mouth. These are the tips of the forceps, remember, that we want to approximate. So if I was in assembly looking at this before sterilization, I wanted to make sure it was ready to go. First, I would check it and make sure it's clean, but then I also want to try to close the teeth together and make sure that these two sides match. Okay? All right. Let me head back over here and let's go back to our notes. Okay. Nope, wait. I'm like, that's not right. That's not right. Okay. Oh, it isn't right. I got y'all on the wrong set of notes. I got y'all on my notes. I'm like, that's not right. That's not there. All right. Okay. So we took a look at general surgery, orthopedics, GYN. We just talked about ENT. We're going to talk a little bit about neurosurgery. So neurosurgery, you're going to see a lot of rongeurs, what we call kerosene rongeurs. similar to the types that you use in orthopedics, because neuro and spine surgery are going to be also cutting away at bone in various places of the body. So Karas and Rogers might be used to cut away bone in the spine or around spaces in the brain. You will also see what we call Penfield dissectors. These are a type of handheld retractor that you'll see in neuro to help them maintain visual field. The thing with these instruments and the thing with all surgical instruments, the reason why you guys have to be certified in order to do this work is because this is precision. You need to look at each one of these surgical instruments and make sure that it's clean and it functions the way that it's supposed to before it gets sterilized. Because I'll say it till I'm blue in the face. The last person that should find out that there's a problem with those instruments is the surgeon. And the reason why they should be the last person to ever come across an issue ever is because this should have been caught in decontam if it was bioburden. It should have been caught in assembly if it was bioburden. If it didn't work between decontam and assembly, it should be noticed by that SPD technician that is not functioning properly and then removed from that set. Okay. If our surgeon is the one that's notifying us about that, that means we have dropped the ball. We need to take a look at our process. All right, next service line, cardiovascular. Okay, so this is going to include your heart surgery. You're going to have a crap ton of different types of clamps. You can think about all the different blood vessels that the heart has, how big, how small some of them are. There's a wide variety of vascular clamps. Even in my 16 years, I've never managed to identify them all. That even if you put that whole set in front of me, I might have to look up a clamp or two. All right. So that being said, take your time with cardiovascular trays. They have a lot of clamps. You want to make sure that you have the right types. Some of them are will have what we call the Bakey forceps, and they'll also have bulldog clamps. I'll try to pull those up for you guys so you can take a look. Bulldog clamps are going to be some clamps that we use that are occluding, right? When we said occluding means that I wanted to completely close the vessel, no blood flow or fluid flow going back and forth. So in cardiovascular, that's what they'll use those bulldogs for. I'm gonna pop those up on the screen for y'all. One sec. And share. And here we go. Okay. So these little guys, these are what they call bulldog clamps. And it might be hard to tell from this photo, but they're very small. They might be just a few centimeters long, okay? So these are something, again, you're going to want to make sure you take time to open them. Make sure that nobody's tissue is left behind. They're clean. They're ready to go, right? And then they go into your surgical set. All right. How we doing over there, Tiki Taki? Did I miss any questions? I ain't got my glasses on, so I gotta lean in for y'all today. I appreciate y'all liking the live. Okay, cardiovascular. We got that. Section three. Now, before I move on, because I only talked about three or four service lines. Okay, there are so many more than this. So many more than this. We talked about general orthopedics, OBGYN, ENT, neuro, spine, and cardiovascular. There's pediatrics. There's sports medicine. There's all kinds of service lines, guys. When you get into your facilities, you will learn more about them specifically. My suggestion to you as you're training to come in is make your focus on identifying instrument names, instruments by visual, if you can get those images going, how you take care of it, how you test it, right? Those are going to be key information for you because once you get on the floor, you'll start seeing all this instrumentation and you will be able to better match it up to the information that you already know how to do. Okay, just learning as you go. So section three, we're going to take a look at. I'm gonna pop this. I'm gonna pop me down. I would tell my surgeons all the time, uh, surgical instruments ain't sold at Walmart. If you break it, I gotta buy it. And then somebody has to put it on a plane or two or a train or two to get it here. So if you break it, it means that it's not available for your surgical patients that might be coming in. There might be a delay in care, okay? Now that being said, sometimes instruments get broken in surgery. Tell your boss, your manager, so that they can replace it. Okay, this is not the place where you want to try to hide and sneak and let them know so they can get a new one. Okay, all right. So we want to make sure that those instruments get cleaned immediately after use for some point of use cleaning. We want to separate the delicate instruments so that they're on top of the heavy stuff so that we don't damage it and we don't have to ship something all the way in from another country at the last minute. And we want to also make sure that we open any hinged instruments. Okay, now what do I mean when I say hinged? Let me show you with this cutting instrument I have in my office. Okay, so both of these instruments right here are something that these are office supplies. Okay, but these are examples of cutting instruments. This one would be a punch because it's a hole punch. I punch a hole. And this one is a scissor. I cut, right? So if I were to be washing these in decontam, I'm trying to take care of these. I would want to make sure that these are in an open position when I clean them. Now, why would that be? There's going to be blood and tissue inside of these spaces if I don't open this up. Also, if I'm putting this through an automated washer of any kind, ultrasonic of any kind, if it's closed again, nothing can get through there. So I want to make sure when I'm cleaning that these things are in an open position. This is going to be the same thing for sterilization. When you guys load these up on the sterilizer racks, they need to be in an open position. If you have the expectation that your sterilant is going to touch the insides of these instruments, they have to be open. If I close it, I cannot have a reasonable expectation that my sterilant is going to touch everything. It's going to get around the edges of this, but it's not the inside interiors of these blades will not be considered sterile. Okay. All right. So I want to open hinged instruments at every point of care, whether it's decontam, assembly, sterilization. I want to open my hinged instruments. Another care tip would be using instrument milk. This is a instrument milk is a type of lubrication. So think about like a WD-40. If this was to start creaking and crackling on me, or it's not really moving smooth, it's not giving a clean cut, I might spray these hinges with an instrument lubrication and make sure that it's smooth and it cuts clean. Okay. Again, I don't know about y'all, but if they were using instruments on me in surgery, I want them to be smooth. I want a clean cut. I want it to be sharp. I don't want nothing snagging right when they are cutting and dissecting tissue inside of my body. Lastly, we want to avoid what they call metal on metal contact. Now, this is kind of like a catch 22 because you will have so much metal in your surgical instruments that there will be almost no way for you to make sure that none of them touch. But the reason why I leave this in here is because I want to make the distinction between stainless steel and titanium. A lot of times within your surgical sets, stainless steel instruments and titanium instruments will be stored in such a way that they do not touch each other. Okay, just a little tip, nothing too crazy, probably won't pop up on your test. All right, last two spots here when it comes to instrument care and maintenance are the most critical ones. The first one there is inspect. That is the entire purpose of your job as an assembly tech is to inspect the instruments. What do I mean by inspect? Look at it. Pick it up, look around, make sure that there's not blood tissue left in the hinges, in the lock boxes, on the tips of the instruments. Okay. I have to look at it. Make sure that the tips approximate, right? They match. I don't have a tissue forceps that's supposed to go like this, but it's going like this. Okay. You want to inspect your instruments to make sure that they're in working order. Then you're going to test them. Now, in your textbook, it tells you the different testing materials you're going to use. So I'm not going to go over that, but I'm just going to show you while I'm here in the office a little example of what that might look like. Okay, so you will have your testing material as described in your ninth edition CRCST manual. And then you're actually going to take the tips of your instruments and you're going to slightly test it. I should be getting clean, smooth cuts. If anything about this cut was jagged, I would put this instrument out for repair and I would get a new pair because again, we want that surgeon to have a fluid motion. They shouldn't be trying to wait. I didn't get half of okay, right? Smooth, clean cuts. That would be an example of a test. Okay. Same thing with my punch instruments. It's going to tell you what material in your textbook you use to test them. But then I'm actually going to be at my assembly test, and I'm going to look like this and see, does it work? Okay. Am I getting a clean cut? Now, I know I'm playing around with my office instrumentation, but I'm gonna use this as an example. Notice how this has that little ridge on the side there, that first hole. I would probably put this off for repair and get a replacement. Okay, because it's not making a clean cut. That makes sense. All right. So when we do the scissor test for sharpness, we want to cut through. You're gonna cut through your paper, and again, you're using the tips of those to test out. Okay. I'm very rarely doing all of this motion. This is where your surgeon is working at. It's right on that tip. Okay. You're going to inspect them for sharpness and alignment and working order. You're going to test those scissors for sharpness. If it's a needle holder or a clamp or something, again, where those clamps are supposed to come together, we want to make sure that they clamp together, right? That they actually close. Usually they will have a apparatus here that locks them. I want to make sure that they actually works. And then if it was a ronger or a hole punch, I will want to make sure that they bite. All right. Okay. So, study tip for section 3, know which instruments are self retaining, age traumatic, or require lubrication. Okay. Those are frequent test terms. I didn't go over them today on purpose because, again, I'm not trying to give y'all everything in the book. You still got to study. But that is a tip there for you as you're doing your reading. Understand those concepts, especially your self-retaining retractors. I don't want y'all to get thrown off by that. All right. Let me check over here, Tiki Tucky. If y'all don't mind, tap that screen while you're hanging out. If you have any questions, just let me know. All right. We are moving into section 4. So, section 4 is going over packaging and sterilization considerations. Okay. So far during this Ready, Set, Sterilize study session, prepping you for your CRCST, we've gone over the types of surgical instruments, the service lines or surgical service lines that they get used with. We've also now just talked about what are some tips to take care of them and make sure that they actually are tested and they work properly before we sterilize them, right? So now I've done all that. I got clean instruments. I've grabbed my account sheet. I know exactly how many instruments go in this container. I'm visually inspected them all. They're all clean. I tested them all. They all work. Now I'm going to get into packaging them and getting them ready for sterilization. Okay. So some considerations when you start to do that. Instruments with lumens or hinges must be open during surgery. So the same way that your hinged instruments, and when we say hinged, we just mean something that has a rocker right there, hinged. Okay. If it's a hinged instrument, we want it in an open position. If it's a lumen or something that we use to suction, we want that suction open. Sometimes they'll have little clamps that buttons to close them up. They need to be all in an open position. Another thing about your lumens is you would have flushed them in decontam. You may also flush them in your assembly area, just depending on your facility. Okay, then we're going to use a chemical indicator inside the sets to verify sterilant penetration. If y'all were in class, y'all have heard me say 1,000 times, we can't climb into the sterilizer to find out did it work or not, right? Once we put the instruments into the sterilizer and we press start, it would be unsafe for us to be in there. If we were in there, actually, we would die because it's going to be very hot. It's going to pull a vacuum. It's going to do all kinds of things, okay? So how do we know if the sterilizer actually did what it said it was going to do? We do that by using testing materials, some of which are called chemical indicators. Okay. So if you missed us talking about chemical indicators, for my YouTube folks especially, go back to the live session 4. We talked about indicators. Okay. So with chemical indicators, we're going to put one in every set. I'll put up a picture for y'all so y'all can see it. And our chemical indicators do what we call a color change test. Okay. So it's going to be testing one of the areas of our sterilization machine, but it will do what we call a color test. And that color change is how your surgical technician is going to know that the sterilization process went well. Okay, because again, they can't climb in there and see. And once it's all sterilized, how am I supposed to know the difference between a sterile set and an unsterile set if I don't have something to visually let me know what's going on? Okay, so let me pull that up just so y'all can get an image. And again, if you've got your books, these are definitely in there. All right, chemical indicators. So here's an example of chemical indicators. As you can see here, oh, let me get it up there. I'll use this one. I'll turn y'all around tiki-taki. So this one is what we call the class 5 indicator. Again, these were integrator. These were covered last week in study session 4. And so if you see here, it says reject and accept. And it's all white right here. They will be white when you guys put them into your surgical sets. Once you press start on that sterilizer and that cycle is then complete, this band here should go completely black. And what you'll notice is it says reject and accept. Once it moves over that blackness, that color change moves over into accept, you're able to say that that sterilization cycle went well, right? Went properly. If any of my color change was over here in the reject section, then we would not be able to use that surgical set. We would need to re-sterilize that surgical set before we could proceed. Okay? Because our test failed. All right. Okay, tiki taki. Okay, let me remove that and then we'll go back to our notes. There we go. All right. I talked about this already when we talked about inspecting instruments, but this is going to be true every area where your instrumentation is held, whether it's decontam, assembly, sterilization, won't care where you go with it. You will have to place heavier instruments on the bottom of your trays, put lighter or delicate instruments on top to prevent damage. You can also use foam or tip protectors for delicate or sharp tools. So, for instance, if I have some sharp scissors in my instrument tray, I might put a what we call a tip protector on the end in order to make sure that it doesn't get dulled out or damaged as that surgical tray is getting moved around, right? Because I'm gonna pick it up, I'm put it on a sterilizer rack, somebody else gonna take it off, put it on a cart, right? So while it's getting moved around, we want to make sure anything that is supposed to be sharp stays sharp. All right. And then lastly, on this, we want to make sure that we complete drying before we go into storage to prevent erosion. This will take place if you're doing low temp sterilization. Your sterilizer is going to have a dry cycle that's going to be a part of that sterilization process for you. And then you want to make sure you cool them down and then put them into storage. If you take that hot tray straight out the sterilizer and then into a cold room, what will happen is it will create condensation and what we call a wet pack. So that condensation, think about like when you got a water bottle and it's hot and then you put a bunch of ice in it, you get that condensation on the outside. That will pool in your tray, and that's what we call a wet pack. So your sterilizer, your high temp sterilizer is going to do a drying session of its own. Then your job is to make sure it cools down slow enough that you don't have condensation and you're going to store it. Your low temp items must be completely dry before you put them into the sterilizer. Any presence of moisture in your low temp sterilizers will cause your sterilizers to abort. Reason being, your low temp sterilizers are utilizing chemicals, mostly hydrogen peroxide most often. And if you introduce water, another chemical, right, to that hydrogen peroxide, it's not able to be effective. So that machine will alarm and abort. Okay. So, quick couple of quiz questions I have for y'all. Y'all can drop the answers in the chat. What type of instrument is a Babcock? Does anybody remember me saying Babcock? Or do you remember it from your reading? Is that a cutting? Oh, I have let me I have my notes on there. Y'all saw that one, so you should know. Look, I said I should have seen that in the chat YouTube real fast. Let me take it off here so y'all can't cheat, even though y'all wasn't cheating that good anyway. Okay, so a Babcock is going to be a grasping instrument. Okay, let me pop one of those up on the screen for y'all. A Babcock is going to be a grasping instrument. And this is one that's going to be considered what I call your basic surgical instruments. You may find them in almost every service line tray. Okay, stop screen, share, share. Yeah. Okay, so this is a Babcock clamp. I'll turn y'all around, Tiki Tucky. Let me flip the screen. I can do it. Okay. This is a Babcock. Now, couple things that right off the bat to help me figure out what this is. One, I know this is a clamp because it clamps closed. This is what we call a ratchet, and that will close. Okay. So when I'm in the assembly section, I want to make sure that that works. I want to close it and make sure that it doesn't open back up on its own. That's another example of what we call self holding. Okay. Self retracting. Then I'm going to check open this lockbox, right? Because I can tell that just like my scissors open up, right? Well, I got to open that. I have to make sure it's clean in this lockbox. And then I want to make sure the tips are clean. And then I also want to make sure that the tips approximate and or meet together. Okay, touch hands and agree. If they hanging off the sides, bypassing each other, then that is not a functional surgical instrument. We would want to put that out for repair and or replace it. Okay. All right. I'll flip y'all back around. Okay. Then the next one I had up there was what, and everybody should know this because I just said it. What is the proper position for hinge instruments during sterilization? If it opens up, should it be in an open position for sterilization and cleaning, or should it be in a closed position? Which one? I believe in you, TikTok. I believe in you. Where y'all at, YouTube? Should it be in an open position or should it be in a closed position? Come on, Lucinda. You better learn something today. Open position. That makes sure that, again, if it's being decontaminated, that makes sure that all the water, chemicals, detergents, and everything can actually touch all the places in the instrument. If it's in sterilization, that's going to ensure that the sterilant touches all the surfaces and actually kills all the germs. Okay. So if it opens, it must stay open for cleaning and sterilization. The next one, I asked, what service line would most likely use a kerosene ronger? If y'all remember from earlier today. Would that be OBGYN, neurosurgery, general surgery, or ENT? Who uses kerosene rongers? Is that A, OBGYN, B, neurosurgery, C, general, or D, ENT? What y'all got? What y'all say, Tiki Taki? Y'all quiet over there. Y'all ain't y'all was tapping the screen. I see that went up a little bit. Y'all quiet. Y'all quiet. What you got, Lucinda? You remember? Your kerosene roger, and while y'all typing, if it's A, OBGYN, B, neurosurgery, C, general, or ENT, I'm gonna pull up a picture of one. And don't hesitate to guess, y'all. We want to study here. Let's answer the question wrong here, so we don't answer it wrong on our test. And you never know, you might just get it right. Okay, over on YouTube, I'm gonna share my screen again. Oops, clicking the wrong thing. All right, there we go. Share screen, kerosene. Okay, so these are kerosene rongeurs. I'll flip y'all around just a hot sec, ticky tacky. We don't want that. That's not giving us good images. I don't want that one either. All right. I'm gonna use that one, but also I want to show y'all just a regular schmegular guy. Okay. So over on StreamYard, let me change how I got this for y'all. And then ticky tacky, I'll flip y'all around. Okay. I'm gonna just leave that over there because we do need to get that done. Okay. Kerosene rongers. I'm gonna flip y'all. Okay, so this is an example of a kerosene ronger. And rongers are bone punches. You're gonna use these to make cuts in bone. They will come in various sizes. I've seen them as large, I think, from or as small as 1 millimeter, and as large as about 7 or 8 millimeters. Now that being said, they might get larger than that. I'm not entirely sure. That's just what I saw. All right. So if you see down here this little tip, this is where the action is. This is where you're gonna cut. Okay. And then, but you can also notice this. You see this real thin layer between the two of them? That's something that I'm going to have to move that handle back and forth to make sure I get all that gunk out of there. Okay. You also, there's another example of these where they actually open up and come apart. So I'm going to show y'all those. You may see both types on the floor at any given facility or one or the other. Okay. They do the same thing. You'll see they're just a little bit differently made. All right. Oh, wait. Did I close it? Mm, oh, 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 there you go. All right. Quickly click, cancel, share. They don't want me to be right on that part. All right. So this is another example of a kerosene ronger, but notice how the top of this is actually you can release it. So this would be released during decatam, and you would be able to clean all in there without having to just like ratchet back and forth this thing, all like trying to get it all squeezed out. You can get access to it a little more better. Okay, so you might see both types on your facility floors. You might, like I said, also just see one or the other. Okay, flipping this back around. Oh, it doesn't have it. Okay, so I'm gonna throw my notes back up for a couple little final reminders for y'all, and then we're gonna wrap up for today. And that will be the end of the study hall series. We were scheduled for four, but thanks to Lucinda, who asked for surgical instrument support, we did today as a bonus session. You'll be able to find all 5 sessions on the YouTube's Candray Institute YouTube page if you go and you look in the live section. It's called Ready, Set, Sterilize, and it's sessions 1 through 5. Okay. Thank y'all, TikTok, for liking the live. I appreciate that. All right. So, my final study tips for those of you that are preparing for the CRCST or the CBSBD. One, use labeled photo guides to reinforce the names of surgical instruments. It's going to help you. Again, not a requirement. This just my tips. You can absolutely try to memorize them by name and service line. And regardless of if you do name and service line and image or just name and service line, you also want to make sure on the back of that flashcard, it talks about the use, how you care and handle it, how you test it, how you clean it, any key information like that, because you may find that on your exam. Practice identifying surgical instruments. unsafe environment for your surgical patient. And the last thing I want to say about surgical instruments as we get ready to wrap up, surgical instruments are expensive. They're easy to damage, okay? Sometimes hard to maintain. That being said, you guys spending time like this, learning how to do this is pivotal and critical stuff. All right. So I want to commend you first and foremost for doing this because y'all didn't pay me for this today and you didn't have to be here. Okay. You chose to show up here. And that type of stuff inspires me to continue to teach you. I've seen a lot of sterile processing technicians on the floor that get their CRCST. I think that's the last time they need to study something. No, there's always new instruments, always new materials, always something new to know in this field. And that's why HSPA and CBSPD require you guys to get continuing education even after you certify, okay? Because there's more to know. Your patients will never see you, ever, but you're going to touch every single one of them that comes through on your surgical schedule. You have to know that. You have to body that, embody that. I shouldn't have to take you to the surgical suite for you to care about whether or not these instruments cut, whether or not they're clean, whether or not tips approximate. You should care because you understand the gravity of what's happening here. Every surgical instrument that you touch is being used on procedure on a patient, and they are trusting you, even though they'll never know who you are. Okay? That is a type of trust and integrity that we need from technicians when they come into this field. Okay? All right. So, if you have any additional questions for me over surgical instruments, whether that be identification, whether that be care and handling, testing, I am available at my email. I'm going to drop that in the YouTube over here. That's candray.institute@gmail.com. You're more than welcome to send me a message and let me know. Maybe you saw a YouTube video or something that ain't making no sense. You can just put it in the email and ask the questions, okay? Um, all like I know I've said it 1,000 times, but again, I know it's new people coming through here, so I apologize for those that is getting repeated. But if you're new here, the Hillman Talk class, we did a free CRCST prep class. It is on our YouTube page in the live section. You just have to go back and go back through. You will need to buy your own textbook. That's the HSPA CRCST Technical Manual 9th edition is what they're on right now. So you could potentially buy that book and then take that free class and take your test. If you're interested in getting a certificate of completion from me for the class, there is a final assignment that is due. So you would have to demonstrate that you went through all of the videos, and then you would also have to go to the website and download the assignment and complete that final essay for a certificate of completion. If you are looking for any individualized coaching to help you get ready for the CRCST or the CBSPD exam, I do have 2 spots that are still open. I try not to do too many because my schedule, as y'all saw for today, okay, it's already a little tight. And I already got 2 coaching clients going right now. So there's still 2 spots open if you're interested in that between now and August. You would just head over to the Candray Institute website and sign up. All right. Coaching sessions are $45 for the hour. They are your sessions. You let me know what you want to study. I will get that prep for you, and then we will go through that material. I also do resume and interview prep sessions. I also do just helping y'all find places to do externship because I know it's tough to find a place to go do your externship. So whatever you need, basically, as a sterile processing professional, I'm here to help you if you need it. Okay. Thank y'all so much for tuning in for this bonus session of Ready, Set, Sterilize, our study hall series preparing us for the CRCST exam. Hopefully, you guys found this helpful. If you're just joining in, head to the live section of our YouTube. You will be able to find all 5 sessions. We basically covered all the basics of sterilization, decontamination, assembly and prep, things that I thought might pop up on your exams. And then today, thanks to Lucinda's asking, we went over basic surgical instrumentation, identification, surgery, service lines, and care and handling. I am your instructor, Alessandra, CRCST, CHL, and CIS. Oh, great way to end. Once y'all get them CRCSTs, turn right around and study for your surgical instrument exam, okay? That's that CIS. So once you get that CRCST, turn right around and get that CIS. That will make you dual certified. Even if you don't have all the experience in the world, that's a leg up, Okay, that shows your dedication to the field, and it's something that you can use to help you move into other positions later on down the line. And as you add on years of experience, that again is just going to continue to set you apart. All right. So I'm glad I ended with that. Y'all be well. Good luck on your exams and what you're studying, and I look forward to hearing from you. Take care now.